Hi, and welcome back to the American Society of the University of Haifa's weekly COVID-19 update. We're delighted to once again be joined by Dr. Manfred Green, Director of the University of Haifa's International Master's Program in Public Health. For more information on the university's ongoing response to COVID-19, which includes last week being awarded funding for 18 research proposals related to combating the virus, please find included in this post. Also, please see a link to find out how to support the university during this time too. Thank you, and over to you, Dr. Green.
Thanks very much, James. And good afternoon, or shalom. I'm going to be talking about masks today, so let's just start very quickly with the count, as we say, the case count. And see, since last week, we've gone up from about 3 million to 3.5 million reported cases in the world. That's an increase of about 17%. Obviously, a lot of cases are not reported. And we've reached nearly 250,000 reported deaths, which is an increase of 25%. Again, a lot of this is probably underestimation. So what I'm going to talk about today is basically a subject which I'm sure is bothering some of us, if not most of us, and that is this whole question of using masks and how useful they are. So let's have a look at them. There are really, I guess, the three masks that you hear most about. The one in the middle is really the surgical mask. So it's a typical mask used in hospitals by medical personnel. And it's a kind of an all-purpose mask protecting, essentially protecting the patient more. That's the idea, not so much the doctor or the medical personnel. But it has a protection the other way. It's a filter. The one on the left is the N95, which is much more difficult to use because it's supposed to be pretty much sealed, airtight, and it's for airborne. Also, it's for airborne particles as well. And the one on the right is the homemade mask that's being recommended. Obviously one example. So let's just look what happened with this whole recommendation of masks and see what the kind of timeline was. In March, the CDC, the United States CDC, recommended that only people with COVID-19 symptoms should wear masks. And there are a couple of quotes here that I'd like to put to you. The Surgeon General, Jerome Adams, urged people last month, that was pretty much in March, in April, but in March, not to buy up the supply of masks. Seriously, people, stop buying masks. They are not effective in preventing general public from catching coronavirus. In other words, this was a very clear statement that these masks are not useful for preventing infection. And I think we'll look again at some of the statements and see what happened subsequently. After we'd heard that the CDC had said that the masks really shouldn't be used, the day after suggesting that it would soon change the guidelines telling non-health workers not to wear face masks, the White House announced a new policy. And now saying that the CDC is recommending Americans wear a basic cloth or fabric mask, and that's what the President Trump said at a press briefing. And he himself said, this is voluntary. I don't think I'm going to be doing it. So the message was, if you want to use a mask, but you didn't really feel that there was a lot of confidence in using the mask. The WHO also, until very recently, said there's no evidence wearing a mask can protect healthy people from coronavirus. Masks should only be worn by healthcare workers and those who are infected. And WHO specifically said that the use of masks in the community may create a false sense of security, prompting people to disregard other measures. And saying that there's no evidence that wearing a mask by healthy persons in the wider community setting, including universal community masking, can prevent them from infection with respiratory viruses, including COVID-19. So here you again getting these very straightforward and very clear messages that the masks are not really of any use. And the WHO said that there are risks of using masks. There are the risk of self-contamination by touching and reusing contaminated masks, potential breathing difficulties, false sense of security, and a shortage of masks for health workers. On April the 6th, there was a statement said that the CDC has changed its policy. Everyone, whether or not they have symptoms, should cover their face with a mask or cloth covering. whenever social distancing is difficult to maintain. The CDC is not saying you should wear a mask wherever you go, rather in places where people congregate. But here is a new message which is not just a new policy message, but they're actually saying, previously we said we didn't think these masks did anything or didn't work, but now we're saying you should use them. So the justification for the shift in policy reflects growing evidence that COVID-19 can be transmitted by a person's exhalations or normal speech, but also the fact that people are not effectively covering their sneezes and coughs. I guess all of us would ask ourselves, was this really new information? I mean, to what extent could we say we didn't know this before April 6th and now we know this? I would say that we might be a little suspicious. And the justification went on to say, we now know from recent studies that a significant portion of individuals with COVID-19 and lack symptoms can transmit the virus to others before showing symptoms. In light of this new evidence, CDC recommends wearing cloth face coverings in public settings. And I want to add here that influenza transmits the disease before the symptoms, the onset of symptoms. And a lot of influenza are actually asymptomatic. So why don't we recommend masks for influenza? That's not a recommendation. So again, we have to ask ourselves, why this new recommendation? I've just put this in on the side that the Onion, who made a satire of these masks, said the CDC reportedly recommended you should also wear a face mask on the back of your head in case the coronavirus attacks from the rear. So obviously they were making fun of the possibility that they would recommend face masks. So what is the evidence? Well, very recently, at the beginning of April, CIDRAP, which is the Canadian organization, on a very careful review said there is no good scientific evidence that masks can prevent the spread of COVID-19. And the masks for COVID-19 is not based on sound data. And this is the quote then from CIDRAP. So again, no scientific evidence, but yes, a recommendation. And the recommendation is in contradiction to the earlier recommendation. So what other evidence do we have? Well, really, if you look at it carefully, the evidence is mainly based on technical, mechanical grounds, almost like common sense. You know, you put something in the front of your face, and that's going to prevent some of your whatever cough, droplets go out, and it'll prevent some coming in. And the surgical mask is reasonably effective in filtering droplets, certainly going out, because that's the reason why doctors wear them, or medical staff, I should say. Homemade masks have some filtration effect. It really depends how you make them. And the N95 is certainly effective against aerosol spread, but it's very difficult to use for long periods of time. It's difficult to breathe. So you can really only keep it on for a certain amount of time. And what happens when people put these masks on, that they go through this process as they wear them, if they wear them for long periods, they'll keep taking them off, putting them on, touching their face and so on. So it starts to lose all its impact. So what has happened really to change the policy? Why is there really new evidence to use masks? Is there a different interpretation of the existing evidence, and why? Well, what were the real reasons behind the policy shift? And I'm asking this as a question, and obviously it's to some extent rhetorical. A lot of public pressure. People saying, we think it's a good idea to wear a mask. People in hospitals wear masks. It might be used to protect you from infecting others, and it may help to protect you. So why not wear masks? So there was a lot of pressure from different circles to use masks. Other countries, such in Asia particularly, are very used to using masks. They use masks, a lot of it they use because of airport pollution, by the way, not so much because of infectious diseases. But it's very common. And certainly you'll find that people from Asian countries, often when they themselves have a cold or some kind of infection, they'll put a mask on themselves. And the third reason is probably one of the most important and unfortunate ones, in a sense, that we just have limited options to control the spread of the disease. We don't have a vaccine, and the social distancing is difficult. So we're looking for other possibilities. So it does put pressure on us to use things that previously we might have said they don't really have any value. So why was there so much confusion? Why is it that there were different views? Why before did they say masks don't work? And now all of a sudden they're saying everyone should wear masks, or at least in some countries. In Israel, for example, Israel, you have to actually expected to wear a mask when you walk in the street, not just when you're indoors. Well, it's really a problem of very poor risk communication. And I know I'm saying this as a very harsh statement, but I think that the statements made by the health authorities in most places were really very problematic. One of the rules of risk communication is tell the truth, even if it's a problem. So if you think that the masks, the reason for not using a mask is because we don't want to use up the supply for medical workers, tell the public that these masks are useful, but at the moment we don't have enough. And first, let the medical personnel, don't tell them they don't work for the general population, because it doesn't make sense to the general population, who would ask themselves, if it's good for the hospital staff, why isn't it good for me? So will the use of masks have any effect? Well, if used correctly, they could have an impact. But the big question is, will they be used correctly? And as I said, I've noticed it here now. People are wearing the masks with their nose, below the nose. They keep taking them off, putting them on. I see people sometimes wearing gloves and no masks, all kinds of combinations. So there's a major issue here, not just on telling people to use masks, but seeing whether that can be used effectively. So what basically is the future? Well, the future is obviously return to school. And should children wear masks at school? I'm not at all convinced that that will be effective. And I would even go as far as to say, I don't think it's a good idea at all. If we have trouble having masks on our faces all the time, aren't children going to have even more trouble? So they'll be pulling them off and putting them on and touching their faces and doing all kinds of things with the mask. So I think that in general, I would probably guess it's better for children. My position at this time is to say children at school should not be wearing masks. Thanks very much.